We'll be recording the webinar and you can watch that later on the same page at boco.org/PH YouTube. I will, if you need interpretation today, I'm going to give the interpretation instructions in Spanish. Buenas tardes. Para escoger interpretación en español durante este informe comunitario, pueden pulsar en el icono del globo que aparecerá en un momento abajo en su pantalla. Cuando pulsen, pueden escoger el idioma, que es español o Spanish. Si nos acompañan desde un teléfono celular, pulsen en los 3 puntitos, escojan la interpretación y el idioma y luego escojan salir. Así podrán escuchar esta llamada totalmente en español. Gracias. Hi, welcome and thank you for joining us today. My name is Angela Cimental. I am the spokesperson for Boulder County Public Health. We are glad that you're here today and we hope that these regular COVID-19 updates will give you an opportunity to hear more about the COVID-19 response here in Boulder County and ask any questions you might have. Today, you are going to hear from Lexi Nolan, Interim Executive Director of Boulder County Public Health, Trina Rowland, Boulder County Attorney, and Chris Urbina, Chief Medical Officer of Boulder County Public Health. And I'm going to go over some housekeeping items here before we get started. So give me 1 minute. Here are some super quick housekeeping items before we get started. We will be taking questions at the end of the update using the Q&A feature at the bottom of your Zoom screen. So please type your questions there during the Q&A section. For those on the phone, you can dial *9 to raise your hand and we will call you to ask your question. So if you need to unmute, use *6. Please keep your questions short so that we can get to as many as possible. Now I'm going to turn it over to Lexi, Executive Director of Boulder County Public Health. Thank you.
Good afternoon. My name is Lexi Nolan. with Boulder County Public Health. Today, I'm going to talk with you a little bit about what we're seeing happening with our COVID cases and vaccinations. Can you see my screen now, Angela?
Yes, we can see your screen.
Thank you. So I want to talk a little about cases and vaccinations and what we're seeing as we prepare to transition to level clear on May 16th. What we really want to see happen before we do that in order for us to have a fun and safe summer together. So just as a review, this is our metric for whether we're able to stay in level clear. It's the 14-day average of COVID-19 admissions as a rate per 100,000. And you can see in the red line, this is where we've been over the past year in terms of this particular metric. And we have only breached the limit that would take us from level clear to level blue once in that time, last fall. So it looks like we're in good shape according to that metric, but I will also remind everybody that we did include a clause that allowed us to use other metrics if we begin to see an emergency situation emerging. And so let's talk a little bit about what else we're seeing in the context of cases and vaccinations. Just to go a little deeper on that metric, let's talk about what we're seeing in terms of hospitalizations and deaths related to COVID-19. This is a graph of the statewide hospitalizations, and you can see that they've been increasing over the past several weeks. We do believe that we're going to hit a plateau and begin coming back down around the end of May. Hospitalizations are a lagging indicator after cases, and we're hoping that the slight plateauing of cases that we've seen lately is going to translate into decreasing hospitalizations, but it's going to take a few weeks to do that. This is a comparison that's a little bit more specific to the Denver metro counties. You can see here that there are several counties that have significantly higher rates of hospitalizations. Boulder County, again, is down here in the red, so we're doing well, but we also know that what's happening in counties around us can affect us at times too. So we want to keep an eye on that. It is a little concerning that they have spiked so significantly in the past 2 months. In Boulder County specifically, we have 29 people in Boulder County hospitals for COVID-19. You can see that that's been a slightly increasing trend as reflecting the previous slide over the past several weeks. And so far in April, we've had 4 deaths, which was a little surprising because we had been doing better in March. And I think what's disappointing, particularly in addition to the tragedy of anyone dying, obviously, is that we're in a place now where everyone should be able to get a vaccine, and these deaths are preventable through vaccines. We are not seeing people dying who have had the vaccination. And that's a really important point. The vaccines seem to be working really well at preventing serious illness and absolutely at preventing death. So we would really encourage people to go ahead and think about vaccines as still a life-saving measure at this point. Just a reminder, even when we go into clear on May 16th, and by the time we have our next bi-weekly meeting, we will already be in level clear, that there will still be additional protections during clear. We will continue as a public health agency to track, investigate outbreaks, provide testing, free vaccination clinics. Our school guidance will still continue to require masks till the end of the school year, as well as other safety measures. We will be providing guidance for summer camps, and we're working, as you all know, on getting our youth vaccinated as soon as possible, and I'll talk a little bit more about that in a minute. Our indoor mask order has been extended. The last meeting I told you that we were probably going to extend it. We are extending it, and Trina Ruland will talk a little bit more about the details about that in a few minutes. And just as I mentioned a minute ago, our hospital admission snapback can shift the public health order at any time during the observational period of 3 months, beginning May 16th. So while we're still in blue until May 16th, these requirements are still in effect: 6-foot distancing in indoor public spaces. Restaurants can be up to 100% capacity. Last call is at 2 a.m. Offices are at 75% capacity. And if you're planning an outdoor gathering of more than 500 people, we ask that you submit a plan. If it's an indoor seated gathering too. Indoor unseated events are capped at 175. So what do we need to do? And this is a familiar slide. I presented it last time we got together. Really 4 key things: keep the pace of the vaccines going. We still have lots of help to support people to get registered to get a vaccination, including transportation to vaccination sites and safe spaces. Please keep getting testing. Free testing is still available at the fairgrounds and at Stasio. Let's make sure we're continuing to maintain transmission control, keep masking, especially indoors, or if you're not vaccinated. And really kind of this continued emphasis on protecting children and youth, who we are seeing lots of cases among, and who many of whom remain ineligible for the vaccine so far. We really need to especially protect during out-of-school activities and follow the guidelines and make sure that parents are modeling behaviors and cooperating with public health officials. So just to look at the data a little bit, we are now at a place where we have over 60% of the eligible population is vaccinated across the Denver metro counties. And if you look at it geographically, you'll see Boulder up here in the upper left corner, and you can see that we do have good density, good coverage of vaccinations. There are no spaces in our county that have less than 25% vaccination rate, and our urban areas are doing very well. The areas in brown that have less coverage are also much less dense population, so they have fewer people in those spaces. If we look a little bit more closely at Denver County, here's a legend, so you can get a little bit of a clearer picture of where we have higher rates of vaccination uptake. So we now have over 185,000 Boulder County residents that have been vaccinated, and that's almost 68% of the eligible population with at least 1 vaccine. And if we break that down according to ages, you can see that we actually have over 2/3 of our residents that are over 30 are now vaccinated, which is fantastic. That is beginning to approach a level that would suggest herd immunity. But it's important to remember that our 0 to 9-year-olds we have 0 vaccinations in that age population because none of them are eligible. In our 10 to 19-year-olds, you all may remember that our 16 to 19-year-olds are eligible for vaccines. And within those 16 to 19-year-olds, about half of them have received at least 1 vaccination. If we break down vaccine administration by race and ethnicity, we do still see some inequities. We're working hard to make sure that everyone has the opportunity to get vaccinated if they want to. And making sure that that includes access to transportation, that there's language access, that there's support to get registered. And we are working hard on making sure that our vaccination clinics also are open at more convenient hours, including evenings and weekends. So if we look at the number of vaccine doses administered, you may have noticed in those graphs previously that we are seeing a slowdown in the number of vaccinations that are being provided. And this graph provides a little bit more detail about that. We do encourage folks to continue to get vaccinated because we do have a few more weeks at a high level of vaccination rate that we need to achieve in order to get to a place where we'll be comfortable going into the summer and comfortable going into level clear. Our 1-week case incidence is 107.3 per 100,000, which is an improvement in the last few weeks. but you'll notice that our positivity rate is still high. And it has been about the same since the beginning of April. So we need to continue to work on making sure those cases stay low. What's a little more concerning is that if we look beyond Boulder County across the state, we do see some counties that are going in the wrong direction and have very high positivity rates that we're a little worried about. So these are cases over time since last March by Metro County. As usual, Boulder is in the red down here. You can see we've been decreasing a little bit over the past few weeks. We're hoping that that trend continues and that also helps to pull our hospitalization levels down within a couple of weeks. You'll notice our cases among our partner counties are a bit high, but also beginning to look like they might be plateauing and coming down a bit. Our 7-day average of new cases is at 52.6, which is an improvement over the past several weeks. But still kind of in this range that we've been seeing since the beginning of March, right? If we look geographically, we see that about 46% of the cases in the past week have been in Longmont, 25%, 26% in Boulder. And if we look at a breakout by age, we see that we still have significantly higher numbers among those aged 10 to 44. And this is not surprising. That's the population that has lower vaccination numbers. One thing that is concerning is that our 10 to 17-year-olds and our 18 to 22-year-olds are now kind of at the same level. Those two groups have very different access to vaccinations. One group is completely eligible for vaccinations, the other is not yet. We need to make sure that anyone who's eligible for a vaccine and wants one is able to get one quickly so that we can make sure that we keep those numbers coming down. We're also seeing a continued disparity among Latinx residents. Part of this is predictable because it takes longer sometimes to provide the support and break some of the barriers that some populations experience in getting vaccines. And so we are continuing to work on vaccine equity, including outreach through our community ambassador program and our influencers who are making efforts not only to reach Latinx and other BIPOC populations, but also to reach LGBTQ populations, folks with disabilities, and other priority populations. So I want to take just a minute to share some data that we're starting to see that really demonstrates the relationship between vaccination coverage and case rates. And this is a perfectly illustrative graph, right? This is 75-year-olds over time, just from mid-December. And the green line is the case rates. And you can see that those case rates have steadily come down. And the reason that they have come down is a result of the vaccination rate, right? And we have 91% of this population is now vaccinated. You can see how low their cases are down here. And this pattern repeats in other age groups, although what you see is that it's a lagging, the timeline is a little bit different because this was, of course, our first population to get vaccinated. So it's able to demonstrate the clearest relationship. And I also wanted to show you the same kind of information, but this is a look at the case rates compared to the vaccination rates for various Colorado counties. And you'll see here's Boulder over here. And this data is a little bit old at this point. This was at a point when we were at about 64% vaccinated. And you'll see that our cases are significantly lower. And the data really kind of stays amazingly close to this line. So you see a high correlation, right? High correlation between lowering cases with increased vaccination rates. And when we repeated this exercise according to different age groups within Boulder County, in fact, what we see is that same pattern. High vaccination rates corresponds to low case rates. And part of the reason why I wanted to show you this graph is because this group right here, this 10 to 17 group, many of whom are not eligible for a vaccination yet, there's a common misconception that those folks are not experiencing high case rates or transmit the virus. But what you can see from this graph is actually it falls into exactly the same pattern as other age groups. So it really reinforces that the vaccinations are really critical for bringing case rates down, and that our youth are experiencing transmission just like everyone else does. So a few things I wanted to highlight today: these concerning rates among children and youth, some of the misinformation, including what I just described to you about children's infection and transmission rates are low. They're not always low. Right now, they're actually rather high. And it's really related to them not being able to get vaccinated yet. That we, kind of did a big return to schools in March. The schools are doing a great job, but that was a big sudden shift in everybody's behaviors and patterns that created, as we all knew, more risk. That's why we were taking preventive measures. It's why we, have very strong protocols in the schools about mask wearing and cleaning and distancing. At the same time, we saw that the B117, sorry, that's a misprint, variant took hold in Colorado right before we got the surge of vaccines. And we've seen eligibility rolling slowly in the youth group. So those are some of the reasons why we're seeing concerning rates among children and youth right now. And as a result, Colorado has the second highest case rate in the United States, just after Michigan, which is disappointing because we've worked really hard and we've made some really smart decisions. But this conflagration of different kinds of challenges all coming down at once have made it challenging for counties across Colorado to keep their case rates low. And I think what else is a result that's important for us to recognize is that if we can't keep our case rates low, then the variants will continue to drive transmission, and it could threaten our ability to have a normal school year next fall. And I know that we all want to be able to get to a point of normalcy where we feel confident that we're able to send our children to school, that they'll be safe, and that they won't have as much disruption as we've had to endure this year. So in terms of the impact of cases on youth, we do have a couple of concerns. We're seeing youth are seeing higher numbers of serious illnesses and hospitalizations, long hauler syndrome and neurological impacts. And we've had 4 cases of MIS-C, which is multiple inflammatory syndrome among children. Cases in Boulder, this is where your organs become inflamed. It often results in visits to the ICU for extended periods of time. And I'd like to turn it over to Dr. Chris Urbina for a minute to talk a little bit more about what this impact on youth looks like and why we're concerned.
Hi, thank you, Lexi, for a nice introduction. This is a big challenge, and I think we were concerned about this when we knew kids went back to school, that this would be inevitable. We'd start to see more cases. Although the schools have done a tremendous job of keeping transmission low within schools, it's the extracurricular activities that have been significant. And now that we see more cases, we're starting to see more long-term effects that's similar to the long haulers disease among adults, among children. And this severe, although rare, condition called multi-system inflammatory syndrome in children, we've had 4 cases in Boulder, is not something to be played with. It's a very serious inflammation of your organs and can lead to significant hospitalizations. We've had over 3,000 cases in the country. And anytime you see a significant impact of over 3,000 cases of this inflammation, 4 cases in Boulder, over 50 cases in Colorado, it really should put us all in a pause to say, what can we do better to protect our children? And I think Lexi set that up nicely. If we can continue to do all the prevention mitigation strategies in schools, that we continue to do that through the school year and summer camps and through summer school, and we get as many people vaccinated as possible, then we reduce the likelihood that children will become infected until they become eligible for the vaccine. It's really all of our responsibilities to protect kids and their health. And I think as a parent, as a grandparent, I think we can make a difference by what Lexi has already talked to. I think that anything that we can prevent serious illness, hospitalization in children that are not vaccine eligible is worth the effort. And hopefully in the next 1 to 2 weeks, the Pfizer vaccine will be eligible for 12 to 15-year-olds. So that we'll be rolling that out as quickly as the federal and CDC give us guidance on how to do that. So we're anticipating a big push at the end of the school year, as well as preparing for the fall. We can make a difference. The vaccine is safe and effective, and we need to continue our prevention strategies. And I'd be happy to answer questions, Lexi, at the end if people have specific questions about the impact on children's health. Thank you for asking.
Thank you, Dr. Bina. So as Dr. Bina mentioned, our 12 to 15-year-olds are expected to have approval for vaccination. We actually are hoping that will happen as soon as next week. Half of our 16 to 19-year-olds have now been vaccinated. And the good news is that the more we can vaccinate now, the better school year we're going to have next year, when the virus is expected to come back in the fall. So our key messages last time were: parents, please help us keep protecting our children and model the right behavior. Number 2, help contain the virus for a normal school year in the fall. Number 3, vaccinations are coming. Number 4, when your family gets vaccinated, it also helps protect younger children who aren't yet eligible for the vaccine, and that's really important. And number 5, our mask order is still in place, and it'll continue to be in place even when we're in level clear in certain settings. So for a fun summer, let's get vaccinated. That's my presentation. I'd like to turn it over to Trina Ruland in our county attorney's office to talk a little bit about what the mask order extension now looks like.
Thanks, Lexi. I'm going to briefly review our mask order extension, which was just extended today for the next 30 days. So that's until June 4th, 2021. Our order aligns with the state face covering order, and we expect our metro partners to implement similar orders in the coming weeks as their order expires. The big takeaway from our extension is that regardless of vaccination status or group size, masks are still required in these settings, which are considered high-risk indoor settings or indoor places where you might encounter members of the public. Those include schools, childcare, indoor camps, all retail stores, grocery stores, and really the public-facing portion of any business where a member of the public might walk in. It also includes high-risk settings such as personal services, which includes things like massage, hair salons, nail salons, etc., as well as healthcare and limited healthcare settings, hospitals, doctors' offices, dentist offices, acupuncture, chiropractic settings, etc. And finally, congregate care settings, assisted living, as well as in the jail. When you are in one of those settings, you must wear a mask, regardless of your group size or your vaccination status still, as long as it's indoors. However, our mask order now aligns with the state and provides these new exceptions for certain lower risk settings, such as offices or private events. In these settings, groups of 9 or less may remove their masks if you are the only 9 people in the room. In these settings as well, larger groups with a sufficient number of vaccinated people may remove their masks. And in general, that requires that 80% of the people in the room, if your group is larger than 9, provide proof of vaccination. As I mentioned, this order is in effect until June 4th, along with the state's order, which is pretty much the same, which is in effect until, I believe, June 2nd. I'm happy to take any questions on that.
Thank you, Trina. So now we are going to open the meeting for questions, and we will answer as many questions as time permits. Our presenters are approaching these topics from a place of respect, and we do ask that you do so as well. If we believe that that is not the case, we may need to mute a participant if necessary. I'm just going to repeat the instructions from the beginning so you know how to use the Q&A feature at the bottom of your Zoom screen. So you can type your questions in the Q&A section. For those that are on the phone, you can dial *9 to raise your hand, and we will call you to ask your question, and you can unmute by using *6. Please keep your questions as short as possible. We will be focusing on questions about the vaccine or anything related to the presentations today. But if you have questions that do not get answered, please send an email to healthinfo@bouldercounty.org. And I think the first questions are for Dr. Urbina. We have a question about children's eligibility. When will children be eligible for vaccine and will be required to receive the vaccine before returning to school in the fall?
At this point, that's a very good question. At this point, until we see the Advisory Committee on Immunization Practice guidelines, we're likely to not have the answer to that question right away. But just like we're encouraging 16 and 17-year-olds to get vaccinated, at this point, we don't see it as a requirement, but as a recommendation. So more to come on this as we learn more from the ACIP. But I would guess that it still probably will be recommended rather than required, because remember, this is emergency use authorization. So at that point, we are still recommending, and that's true for adults as well. So I hope that answers your question. More to come.
Thank you, Dr. Urbina. We have another question for you. So we're being asked about the vaccines that are authorized for 12 and 15-year-olds and maybe 2 to 11 next fall. So they're asking, how will Boulder County Public Health target these populations? And will the health department get a freezer that would be part of this effort, since those vaccines will be available, need a certain amount of or degrees of freezing?
Great, that's another good question. We probably should hire you as one, because of your question. That's really a logistical question. Early on, when we got both the Pfizer and the Moderna vaccines, they required this super low refrigeration. And so we worked very closely with our healthcare partners and our local healthcare systems, so that, because they had these freezers, and we also worked with pharmacies. So those vaccines are still in those places, and so we'll be working very closely with those facilities, because not everybody needs to purchase one of these super cold freezers. Hopefully we can figure it out. So the logistics of rolling out this vaccine, and it looks like the federal government is going to recommend pushing the vaccines for this younger age group, the 12 to 15, and hopefully if it gets approved for younger, 2 to 11, through local pediatricians, family practices, community health centers, where the trust is the greatest, as well as where that relationship of children getting vaccines in those community settings is the greatest. But it's likely to include our healthcare systems, our pharmacies as well, because they have those safe storage places. So more to come on that. This is a great question, and we're logistically going to have to figure that out, because there'll be obviously more vaccine available for those that are eligible with the younger age groups.
Thank you, Dr. Urbina. I think we have two questions for Trina. One is about the mask order. People are asking if there are revisions for live events that allow performance to be closer to 25 feet without a mask to the closer to the audience, or is it still that distance and 12 feet with a mask between performers? How does that work for a live event?
That is a good question. The state is still recommending 25 feet between performers without a mask and their audience. However, depending on the specifics of your situation, you may be able to be as close as 6 feet if you meet that vaccination threshold or that per person threshold.
Thank you. And we also have a question about the blue level. What is the restaurant capacity while we remain at blue level?
I need to double check that because I actually cannot cite that off of the top of my head. If you'll give me one moment.
Absolutely. We have one question. This is related to the vaccine for youth, and this might be for Dr. Urbina or Lexi. It says, when is the vaccine for youth expected, and is it safe?
Go ahead, Lexi. You want to take a turn, and then I can add?
Sure. I do want to go back to the restaurant capacity question. It was in my slides previously, and restaurants are allowed to have up to 100% capacity with 6-foot distancing between groups. And
that's correct. I just confirmed it. Thanks, Lexi.
You bet. And the second question was a question about
vaccines for youth. Are they safe?
Yes. So part of the reason why we've had a delay in being able to authorize those vaccinations is because they've been in trials in similar ways that adult vaccines were run through trials. The children's vaccines have to be run through trials also. And the way that they structure those is by age groups. So they want to kind of increasingly move down the age and watch carefully those children who are in the clinical trials to see what kind of adverse effects there may be. And what they're seeing is that children are tolerating the vaccines extremely well and that they aren't seeing problems, anything unexpected, anything particularly different from adults. And for that reason, they are looking at authorizing 12 to 15-year-olds next week. It's not surprising that 6 to 11-year-olds will take a little bit longer. Those trials won't be done for a little while. They like to be a little bit more cautious when they go down the age ranges, just to watch for, because children are in different developmental stages, but they are expecting that if there are no surprises with the studies, that they're hoping for emergency use authorization in 6 to 11-year-olds by September. And Chris, do you want to add anything?
I think you're right on. I think that's exactly how the clinical trials work. The good news is that we also have the vaccine adverse events reporting system that is very careful. We require all clinicians and providers to report any adverse events. And so we've been watching this very closely. I had a question earlier from a community member, do we pay attention to those adverse events? And the answer is yes, absolutely. And so those, we've given over 200 million doses of the Pfizer and Moderna vaccine. So far, we've seen very little serious adverse events. So that's a good sign, and that bodes well for the 12 to 15-year-old group as well.
Thank you. We have a question about women getting vaccinated. So there have been reports, or they have heard that women have issues with their cycles after becoming vaccinated. And should parents be concerned about this when they want to vaccinate their daughters?
Great question, and I'm glad parents are concerned about their daughters. I think that's very important. I've looked at those studies, and I've looked, and the trials were also done in a significant number of women. And remember, we've given 200 million doses of these vaccines, the mRNA vaccines, to adults, and nearly half of them have been women. And there have been no direct cause and effect relates to either fertility or menstrual cycles, or in any change in your abilities to reproduce in the future. So that's been well studied and documented. So I hear that. I've looked at the studies, and that is not true. It's misinformation. But keep asking these questions, because we want to give you the most accurate, up-to-date information. If you think about it from a scientific standpoint, the mRNA releases a spike protein into your cells, and that spike protein is reacted to by your immune system. So it doesn't interfere at all with either male or female hormones. So it's, from a logical scientific perspective, it should not impact your menstrual cycles. Now, as you know, menstrual cycles can be impacted by stress, by anxiety, by losing weight, by a whole host of reasons for a disruption in your teenage daughter's menstrual cycles. So if that's continuing to be a problem, then I would encourage you to talk to your health provider to get more information about something else that may be going on with your teenage daughters.
Thank you, Dr. Urbina, for your thorough response. We have a question about Lex's presentation. People want to know, what is some practical advice? How can parents protect their children against COVID, especially if they're thinking about sending them to camps? And is it safe to send kids to camp right now if they cannot be vaccinated?
So that's a great question. So we are expecting more guidance from the state about summer camps, but I think that the message is the same message that we've been providing all along. It's the same practices that will keep your children safe in summer camp, that keep them safe in school, or when they're out in public if they are practicing those protective measures. Wear a mask if you're indoors, if you haven't been vaccinated, or if you're around other people that haven't been vaccinated. Wash your hands. Don't stand closer to people than you need to. But really, it's the same kinds of practices. We know folks are excited about summer camp. A lot of folks feel like they missed out on summer camp last year, so we think the camps are going to be pretty full this year. And that's great, especially if there's a lot of time spent outdoors. That's super healthy for kids, and we need kids to get back into a healthy space and be interacting with their peers and be having fun together. And the message is you can have fun and still be safe at the same time.
Thank you, Lexi. We do have a follow-up question about live events and performers. This might be for you, Trina. Can performers be closer to the audience, and is that contingent on the audience actually being vaccinated? Do they have to show proof that they have been vaccinated?
That's a great question, and it's a little hard to talk in hypotheticals, so I'll answer it generally, and then I encourage you to reach out to our business team and we can help you work through your specific situation. And Angela, if you wouldn't mind dropping the COVID business team email in the chat or in the Q&A, that would be great. So until May 16th, there are restrictions on indoor events that require social distancing. Whether or not a person can be closer based on vaccination status is not written in the order or in the mask order right now. So I don't think that really matters. Whether or not the performers and audience themselves has to wear masks depends on the audience size, and will also depend on the number of people who have shown proof of vaccination. And that does mean showing the CDC vaccination card or a photo of it on your phone. But once again, it's hard to talk in hypotheticals as every situation can be unique. So if folks have questions, how does this apply to my event, performance, restaurant, etc., we do have a fully stacked business team prepared to help you navigate these, not just our orders, but also our best recommendations and practices.
Thank you, Trina. We have a question about hesitancy for the vaccine. Someone is saying that they're vaccinated, but they're having trouble with other family members who are hesitant about getting vaccinated. They're asking, how can I convince them? How can I get them to vaccinate? Because otherwise we can't really get together. Is this a question for Dr. Urbina?
Sure, I can try it, and I'd be happy to have Lexi and or Elizabeth answer as well. First of all, I think we have to listen. I think we truly have to listen to people's fears and concerns about the vaccine and their health. Once we listen, I think we can understand where people are coming from, and hopefully, as we listen, we'll learn about what their fears are, and then try to address their fears with the best evidence. And the best evidence is that these vaccines are safe and effective. And if people need referrals, point them to accurate information like the Center for Disease Control website or Boulder County Health Department website that has lots of frequently asked questions to answer their questions. But I think the shame and embarrassment does not work. We have to talk to people where they are at. And I've answered thousands of these questions. And so I've learned to say, what are you concerned about? Let's talk about it. Let's point you to information, point them in the right direction so that they can get the best information possible. And hopefully they'll make that decision to support you. And then I think approaching it from a level of respect and caring, and talk about why you got the shot is also important. So you're a trusted family member. So use your best reasons for why you personally make that choice, and then point them to their healthcare provider who will also help them make that decision. I hope that helps. Lexi or Elizabeth, do you have anything else to add?
Yeah, sure. Yeah, I think it's important that we want to hear what people need to hear. What is that you are needing to understand, or what are the fears? What are the doubts? What are the things that are being said, so that we can, without prejudice, we just want to hear. We just want to hear what is happening out there. You can let us know, or we are in the website. We're always updating information as well, information that is trustworthy. So yeah, I mean, that and asking, of course, you can get close to your personal healthcare provider. Always will be available too. So, but if any questions, you can even call in our call center and ask any questions that you have, any commentaries that you have, and definitely send us an email as well, because that's what we are here for, to help you make that decision, whatever decision is, but that that you can have access to the best information that science can provide you. Mm-hmm.
Thank you. Thank you both for your answers. There is a question about vaccine status and asking for vaccine status from clients. Is there anything such as HIPAA regulations that would prohibit a private club from asking vaccine status from members? That might be for you, Trina.
Yeah, so that is a really great question. Unfortunately, I can't provide legal advice on that point, but we do expect the state to be issuing guidance for businesses and private club members around asking people to volunteer their vaccination status. And we'll push that out as soon as we receive it.
Thank you, Trina. We have one more question about the mask order. you know, even as people, some regulations are relaxing, in what situations do you recommend that vaccinated people still wear masks?
I'll answer the first one part of that first. So the order does require masks for all people in those public facing settings, such as retail stores, grocery stores, et cetera, and in government facilities as well. As to where it's recommended, beyond that, I'll let Dr. Urbina answer that.
Thank you.
Thank you, Trina. It's a question of risk. In indoor settings, obviously, you are more likely to be close to people, and the air is not circulating as much as you're as an outdoor setting. So if you don't know the status of your folks in the room, if they're more than 10 people, and you don't know if they're unvaccinated or not, it's probably prudent to continue to wear your mask. And as well, if you know that any of those folks may have chronic medical conditions, like they may have cancer, immunocompromised, or something or elderly, and that you may not know their vaccine status. So I think it's always helpful to use your best judgment and assess the risk and follow the rules as Trina has outlined. I'm not a lawyer. So I think that look at the guidelines that Trina has outlined, but I do know that it really is about risk, and you can prevent the infection by getting vaccinated, of course, because they're safe and effective, and then wearing a mask when you are not sure about those unvaccinated people, and certainly indoors.
Thank you, Dr. Urbina. Lexi, do you want to add anything?
I would invite people to consider thinking differently about masks and their role. There are a lot of countries in the world where wearing a mask on the street is ubiquitous. Everyone does it. It's normal. It is just part of protecting yourself. And I'm not suggesting that everyone in Boulder should move to that kind of a practice, but I am suggesting that it's not unreasonable to feel comfortable wearing a mask and to expect to see people continue to wear masks for a while, while we're dealing with this pandemic. It's not done yet. It's not done with us. The goal is not to stop wearing a mask. The goal is for us all to be safe and to feel safe and to, really be able to go forward together.
Thank you, Lexi. We have one more question. After that, we'll do some closing comments. And this is for Trina. Can businesses require people to wear a mask?
I'm going to answer that question this way, because there are some medical exceptions to wearing a mask, and so it gets a little tricky, but nothing in this order prohibits a business from requiring masks if they would not otherwise be required under the order. So that would be a really small group of businesses that wouldn't be required to always have masks on with folks, but nothing in the order prohibits that from happening. If you want to, as a business owner, require masks, we are not stopping you, and we would probably encourage that if you're indoors and not otherwise required, not public facing, whatever it is.
Thank you. We are nearing the end of the event. Lexi, do you want to give a final statement before we close?
Sure, Angela, thank you. So we've been doing these meetings for quite a while now, and as much as we enjoy it, and we do enjoy interacting with folks, we're beginning to see some drop off in participation. And we are also beginning to be hopeful that vaccinations are going to change the urgency of some of this information, and maybe some of the need for quite as many questions to be answered in a live event. So we may be sunsetting this report in the future. We'll do at least one more. The next one will be a couple of days after we have transitioned to level clear, and we'll do an assessment then. about whether these community meetings will continue. But just to remind everybody that if you have questions, you can call the call center and get questions answered anytime then.
Thank you, Lexi. We want to thank you for being here, for joining us today. You know, the next community update will be on May 19th. And if you need to be updated until then, go to our webpage at covid.org and visit our social media pages for daily information. If you have any additional questions, please send them to healthinfo@bouldercounty.org.